Hello, my name is Tabitha Bird, and I am a registered nurse in the state of Virginia. And I am here today to discuss the role of delegation as a registered nurse in Virginia. Before we begin, you need to know the definition of delegation as it relates to nursing. According to the Code of Virginia, delegation is when a registered nurse authorizes an unlicensed person to perform selected tasks and procedures. As a registered nurse, you can delegate to licensed practical nurses and/or unlicensed nursing personnel and assistive personnel. For the purpose of this video, we are focusing on the unlicensed personnel. According to the Virginia Code, you can only delegate after meeting 5 criteria, which fall in line with the 5 rights of delegation. You need to have the right task. The delegating nurse judges that the task or procedure can be properly and safely performed by the unlicensed personnel and that it will not put the patient's health, welfare, and safety in jeopardy. The right circumstance. The patient is made aware by the delegating nurse of the personnel's unlicensed status when necessary, and the unlicensed personnel will have a name tag on while providing the care. The right person. The delegated task and procedures are within the delegating nurse's knowledge, area of responsibility, and skills. The right directions and communication. The tasks are communicated with specific, clear instructions for the performance of activities, expected results, and potential complications that are specific to the patient. The right supervision and evaluation. The delegating nurse will remain responsible and accountable for the nursing care, including assessing, planning, documenting, evaluating, and supervising. Remember, according to the Virginia Code, you are responsible for supervising any delegated tasks. The best way to ensure that they are being followed through correctly is to ask questions of the unlicensed personnel like, is that task completed? How did the patient respond? And did you observe any changes? Asking these questions will assist in monitoring the performance of the delegated task, evaluating the patient outcome, ensuring the documentation is appropriate, and making yourself available for consultation and intervention as needed. Do not forget that as a registered nurse, you are responsible for assessing every patient to ensure that you are aware of their clinical status and stability so you can effectively determine the complexity, type, and frequency of the care that is needed before you delegate any tasks. In order to effectively delegate, you also need to know the skills, experience, and training of the unlicensed person you are delegating so you can assign them the appropriate tasks. In summary, delegation is a complex decision-making process and is a learned skill related to making appropriate nursing judgments. It can be successful when effective strategies are learned and implemented, and when done correctly, can improve person-centered care. Thank you. For more information, you can refer to the Virginia Law Code at these websites.